Why do I have irregular periods? So, hi everybody, and welcome to the live today. So, perhaps your periods are irregular, but you can't work out why. Perhaps you've had blood tests done and they've come back normal. But what now? So, let's discuss the reasons why your periods are irregular and what you can do naturally to regulate them. I'm so thrilled to be here today, and for those of you that don't know me, my name is Michelle Cooke. I'm a hormone and fertility naturopath, and I'm also a naturopathic emotional release practitioner as well. I'm the founder and director of Reproductive Wellness, a clinic located in Melbourne in Australia, and I see patients online and face-to-face. So if you have any questions or comments as we go through the live today, just be sure to pop them in the comments box down below and I'll answer those for you. And you can always send me a DM afterwards as well if you're a bit shy, and I'll answer that question for you. I'm more than happy to do that. And if you're enjoying the content as well, just be sure to hit the love hearts and the likes. I really enjoy that, just so I don't feel like I'm talking to a screen and there's actually people watching me. Okay, so let's get started. So before we crack into the content today, I'd just like to clarify something about normal blood tests, okay? So I see a lot of patients who come to me and they've said, my blood tests are normal, I've got irregular periods, I'm not sure what's going on, what do I do now? And just because your blood tests come back normal doesn't necessarily mean that nothing's entirely wrong. And you need to remember it's because doctors actually read pathology tests very differently. So they're reading them from an emergency room perspective. So they're looking for symptoms and disease. And the range in a pathology test is very, very broad. So we need to remember that. And it's not their fault because doctors are actually trained very differently. So as I mentioned, they're actually looking at symptoms and disease. So if you fall out of that wide range, then that's when they'll actually act and do something and treat you. So basically, naturopaths look at pathology tests very, very differently to that. So within that range is known as an optimal range, okay? So it's kind of in the middle-ish of that broad range that we're sort of aiming for. And for optimal health, your results need to be in amongst that kind of optimum range. So I hope that makes sense. The other issue that I find is that even though you've been sent off for test results, so you have irregular periods, you get sent off for some tests, often things are missed, and I see this time and time again. So nutrient deficiencies aren't tested because that can be a contributing factor. Hormones aren't tested on the right day. I see that all the time. So particular hormones need to be tested on day 2 or 3 of your cycle, and then day 21 if you've got a regular cycle, or 7 days post ovulation if you've got kind of a differing cycle to that. Plus there's other sort of important things that might be missed as well. You have to be very thorough when it comes to irregular periods because there's so many different reasons why it could be actually happening. So let's get into it, shall we? So about irregular periods. So your periods would be considered to be irregular if the gap between each period keeps changing, or the gap between your menstrual cycles. So your menstrual cycle is from day 1 of your period till the day before your next period, okay? So that time frame is changing from cycle to cycle. So essentially, your period sort of is, you expect it at a certain time and then it's not actually arriving then. So your period might tend to come earlier or it it might come later. And when you actually get your period is quite variable and unpredictable, so it could be sooner than expected or later than expected, as I mentioned. And keep in mind, if your period is late, that means you've ovulated later, okay? So it's a consequence of late ovulation. Whereas if your period has arrived earlier, you have potentially ovulated earlier, or you may not have ovulated at all. So your period will generally follow ovulation. So generally it's around about sort of that 14 days later, okay? However, just because you have a period doesn't mean you necessarily ovulate. So that's an important thing to remember as well. Your body will just reset regardless. So if you haven't ovulated, it will just kind of clean out house as such. So it will just have a period and reset and get ready for the next cycle. Also, if your menstrual cycle, so day 1 of your period to the day before the next period is too short, you may have not ovulated at all. So keep that in mind. So what's considered a normal menstrual cycle length? So again, that's from day 1 of your period right up until the day before your next period. That's a menstrual cycle. So it should technically be around 27 to 35 days in length approximately. That's what we want to aim for. And of course there may be some slight variation from cycle to cycle, but it shouldn't be sort of, you know, way up and then way down. It shouldn't be like 21 days and then 40 days the next cycle, for example. It shouldn't be too drastic, just maybe a few days here and there adjustment. So what are some of the reasons for irregular periods? Well, there is so many different reasons, so let's go through them today. And there's so many different types of scenarios and conditions that can impact your hormones, which as a result will change the timing of ovulation and the timing of your period. So stress is a massive one. So when you are stressed, your body will move you into fight or flight mode, which is basically a primal survival, sort of instinctive survival mechanism that we've had built in place to protect us from perceived danger. So maybe the danger isn't life-threatening, but your body doesn't know the difference between a life-threatening situation and your boss being a bit of a tool, for example. Maybe he's, you know, putting the pressure on you and sort of being unrealistic, and that's causing you to feel stress. Your body thinks that you're about to be eaten by a shark in that scenario. It doesn't know the difference between those two stressors or things that cause stress. So as a result, stress will actually shut off the production of your girly hormones, because it's not actually a safe time to reproduce and make babies, even though that may not be your desired outcome. The body's trying to protect you. It's not the time to reproduce, it's the time to run or flee or fight the shark, okay? So that's why it actually shuts off hormone production. So if it's doing that, of course you're going to end up with irregular cycles, and usually if you're stressed it will delay ovulation, so you'll end up with a period that will come a bit later because ovulation's delayed, and as a result your period will come later too. Now, night shift or shift work. So all of these next things I've popped under stress because these sort of cause a stress to the body. So it's the same type of response that I spoke about before. So night shift or shift work, intensive exercise, so going a bit overboard with it, sleep issues, so if you're having trouble sleeping, not sleeping well, not getting good quality sleep, rapid weight loss, jet lag, nutrient deficiencies is another one as well. Hormone imbalance, so that's a separate one as well. However, stress can impact that too. Eating disorders, so anorexia and bulimia, because again, that's very stressful for the body when you're not eating enough or if you're eating too much. That's quite stressful and it will shut off production of girly hormones. Menarche. So menarche is around the time of your first period. So the first couple of years, it's normal for your period to do little jump starts and for your hormones production to for your body to get used to producing hormones, to get used to ovulating and, regulate your periods as well. So it's very much in the learning phase during that time, especially in the first couple of years, as I mentioned. So don't be too alarmed. Coming off the pill. Now this is really, really common. So when you come off the pill, your body has gone from not producing its own hormones. So please remember that. So when you're on the pill, it actually instructs your body to stop producing hormones. Okay? To suddenly you've stopped the pill and it's having to actually take the reins and actually start producing hormones again by itself so that you can have a healthy menstrual cycle, healthy ovulation, and healthy periods. So often it will try to do a few trial runs, okay? And it may jumpstart on and off with a few attempts at ovulating. So that can cause irregular periods as well. Perimenopause, so the journey towards menopause essentially. So menopause is when you're 12 months without a period, but perimenopause is that sort of rocky journey towards menopause. It shouldn't be rocky technically, but for a lot of women it is. And this takes place a few years beforehand. Now, breastfeeding is another one. So your body is very clever. So when you're breastfeeding, prolactin is produced, which is a hormone that your body produces in high amounts in order to actually produce breast milk for your baby, right? To provide nutrition for its growth and development. But as a result, this high prolactin will suppress ovulation. But that's not such a bad thing because the body is trying to get you to prioritize that baby's health. It doesn't want you to reproduce and have another baby at that point because then you'll be quite nutrient deficient and you're already having to provide for that baby that you've got currently. So the body's very smart, isn't it? And if you're not ovulating, just remember you won't get your period. So that's why that happens during that time. Now, polycystic ovarian syndrome or PCOS, that quite commonly will present with irregular periods, and that's due to the high androgens, so the male hormones like testosterone, and too much insulin as well. This will impact whether ovulation actually takes place or not. Sometimes you'll actually skip ovulation, or sometimes you'll have it but very erratically, and it's due to those hormones being out of balance. Primary ovarian insufficiency or premature ovarian failure. So they most commonly refer to the first term. Oops, are you still there? Sorry about that. So most commonly they refer to the first term, so primary ovarian insufficiency. And basically it's either a lack, irregular or occasional periods that are happening due to the poor function or loss of ovarian function before 40 years of age. So as I said, the first term is more representative of that because it's not a complete lack of ovarian function in all cases. Sometimes it might just be not as good as it can be. Medications is another reason your period might be irregular. Smoking marijuana, cigarettes, or vaping. Illicit drugs is another. Diabetes, uterine polyps. So they're abnormal growths that can actually grow on a stalk that's attached to the uterine lining. Uterine fibroids, so that they are benign abnormal growths that are occurring within the uterine muscular wall, usually. However, there are some that can grow on stalks that can kind of protrude into the uterine cavity and attach to the uterine lining as well. Thyroid issues is another reason. So lots of different thyroid conditions will actually cause irregular periods. So hyperthyroidism, so that's an overactive thyroid, so it's producing too much thyroid hormones. Subclinical hyperthyroidism, so that's when you've got low TSH, which is commonly seen in hyperthyroidism, but you usually have sort of normal-ish thyroid hormones, so they're not really too askew. So it's kind of hyperthyroidism, but not to the full-blown extent, if that makes sense. Hypothyroidism as well. So when your thyroid is underactive and it's not producing enough thyroid hormones. And subclinical hypothyroidism. So again, you've got a slightly high TSH, except your thyroid hormones, are looking kind of normal-ish. So that's T4 and T3 that I'm talking about. So it's not sort of full-blown hypothyroidism, but with any type of subclinical sort of thyroid condition, you can still feel awful and you can still have symptoms as a result of having that. So don't forget that. Graves' disease is another one. So it's an autoimmune disease that results in the overproduction of your thyroid hormones. So kind of a hyperthyroidism state. Hashimoto's thyroiditis. So this one is another autoimmune disease where your immune system or your immune system actually produces antibodies that attack your thyroid gland. And this can result in either hyperthyroidism, so it can be overactive, or hypothyroidism, so it can be a bit underactive, or sometimes it can swing between the two. Also, it's important to note that you can have irregular periods after you've had COVID. So that's actually proven in the research now. So it can either be a short menstrual cycle or a long menstrual cycle. So you're either getting periods more often or less often, etc. And also after COVID vaccinations as well. So again, that's in the research that's been shown to actually have an impact on your menstrual cycle length, and it can become irregular as a result of that as well. I've actually got a masterclass that I've done, which is called Periods Not the Same After COVID. So once that recording is ready to go, I'll let you know, and you can actually purchase the replay of that. So all the information about that is in there, and how to actually, how to actually look after your periods and your hormones and menstrual cycle after you've had COVID. So that's something to look at as well. So I'll let you know and keep you in the loop. So just make sure that you follow me on Instagram or Facebook for any updates of when that recording is going to be released. Now, so what can help with irregular periods? So as you can see, there's so many different reasons why it could actually be occurring. So the treatment at the end of the day depends on actually why it's actually happening for you. And I would suggest that if you're not sure why it's actually happening, why you're getting irregular periods, that you take a trip to your GP and then be referred to a gynecologist if need be. But also taking booking a consultation with a hormone and fertility naturopath like myself, so that we can look at your pathology tests a little bit differently and make sure that, we're looking at nutrients, we're testing hormones on the right day and looking at optimum levels rather than sort of the broad range that's on the pathology test. But let's talk about some sort of general advice anyway in regards to periods and hormones and regulating your cycle. Just as sort of some general overall advice for you, okay? So Zen Zone. So promoting relaxation in your life is extremely important. And it's extremely important because, as we have seen, if you are stressed, it will actually delay ovulation, which will cause irregular periods. So it will cause a delay in your period your next period arriving. So things like meditation, yoga, a nice quiet stroll in nature is really good. Also running a hot bath is another great idea. So anything that gets you into that state of relaxation. Whoosh exit. So you're probably thinking, what the heck is that? So you need to make sure that once your hormones have finished their job in the body and they've done what they needed to do, you need to make sure that they've got some way out. So your bowels are actually involved in removing excess estrogen from the body. So if you're constipated, if you're not going to do a poo at least once a day, this will result in hormones being reabsorbed back into the body, leading to hormone imbalance. And commonly that's estrogen excess. And that results in irregular periods as well. So we need to be preventing constipation with things like drinking water. So aiming for 1.5 litres per day, or technically it should be 30 mils per kilogram of body weight. Moving your body, that's essential. So exercising for 30 minutes 3 times a week at the very least is really, really important. And fiber, so including things like chia seed, which is high in fiber, and omega-3, 6 and 9. And also lots of fresh vegetables as well. That's a really good source of fiber as well. Lush fats. So healthy, organic, saturated fats are very, very important for hormones. In fact, cholesterol is the building block for your girly hormones, so it's absolutely crucial that you include these foods in your diet. If you don't eat enough fats, this will cause hormone imbalance and irregular periods. So including things like avocado, organic coconut oil, and organic butter. Happy belly. So your gut contains a crew of good bacteria, which is known as estrobolome. And the estrobolome produce an enzyme called beta-glucuronidase. And this will break down the estrogen, either to be escorted out of the body via your bowels or to be reabsorbed to get to work in your body. So it's the perfect amount of estrogen that gets reabsorbed. It's all about balance. So it's not like what I discussed about constipation with that big whoosh of too much estrogen. The enzyme that's produced by that bacteria knows sort of how much estrogen you might be needing. So it's very, very clever, isn't it? So including foods and drinks that support that healthy bacteria in the gut is, that makes sense to do that, doesn't it? So we need to be supporting that good healthy bacteria, but also making sure that the environment is really nice. So we need to be a bit of an interior designer to make it desirable for that good bacteria to set up shop and make it its home. So things like sauerkraut, kimchi, water kefir, and bone broth is a good idea to include. Plant estrogens. So plant-based foods containing phytoestrogens are really important for providing a protective role against harmful xenoestrogens. xenoestrogens. So xeno is foreign, so foreign estrogens, and they usually come from chemicals in our environment. So chemicals from things like personal care products that we're using, cosmetics, cleaning products in the home. So they're coming along and pretending to be estrogens. So the phytoestrogens will come along and actually attach to the receptor and block it so that those xenoestrogens don't actually bind to that receptor, because if they do, it causes a lot of issues. So it's kind of like a lock and a key mechanism. So if you think of the phytoestrogen as the key, and the lock is the estrogen receptor, it sort of slots into that lock very nicely. So that's really, really important to be including them to stop that harmful estrogen from binding. So including foods like linseeds or LSA, which contains linseed, sunflower and almonds, so you can include that. And legumes, so things like lentils, chickpeas, kidney beans, borlotti beans, all those kind of things are good healthy sources of phytoestrogens. Warm it up. So warming spices can be good to promote circulation and nutrients and blood flow. It's getting to that time of night, isn't it? To the ovaries for proper function, and to assist with regular periods as well. So things like cinnamon and ginger are really warming, and they're going to provide a lot of circulation and oxygenation to the ovaries so that they can function well, okay? Orange ways. So your ovaries need an abundance of vitamin C to actually function properly, for your follicles to mature, develop, and for ovulation to take place. So it makes sense then to include things that contain vitamin C. So foods like berries, red capsicum, citrus fruits, so your lemon, grapefruit, kiwi fruit, oranges, papaya, cruciferous vegetables as well, so broccoli and cauliflower and cabbage, for example. Including those is very important. Sweet hijacks. So eating and drinking high sugary foods frequently causes a high rise in blood sugar levels. So that impacts the ratio of estrogen and progesterone. If you've got a hormone imbalance, that will lead to irregular periods. It's all about a delicate balance in the body of estrogen and progesterone, by the way. Also, high sugar results in inflammation in the body, which causes hormone imbalance. If you've got hormone imbalance, that will lead to irregular periods, so not good. So we need to be avoiding things like soft drink, cakes, lollies, and we need to be switching for more healthier alternatives. Instead of soft drink, we could reach for kombucha. Instead of lollies, we could go for a chia pudding, for example, or protein balls, because they've still got an element of sweetness there, but they've got the protein to balance out your blood sugar levels, so it won't lead to that sort of massive peak in blood glucose levels. So those are my tips, just general advice for improving irregular periods. But of course, if you have irregular periods, it's important, as we know, to actually find out why it's happening so that we can address and treat why it's actually occurring for you. It makes sense, doesn't it? So can a naturopath help with irregular periods? So absolutely, and especially a naturopath that specializes in hormones and fertility like myself, which is what I do. So in clinical practice, I use things like herbal medicine, nutritional medicine. I look at your pathology results, so aiming for that optimum range on your pathology results is really important. And when we're testing, we're sort of looking at things like your hormones, we're looking at sort of other general things like full blood count, etc. We're looking at nutrients as well to see if there's any deficiencies there that are contributing to that. yeah, and obviously diet and lifestyle advice as well is something that we discuss too, because that has a huge impact on healthy periods, menstrual cycles, and hormone balance. Really, really important. Also, I use a technique known as naturopathic emotional release. So that's really important at sort of addressing any underlying factors that are affecting sort of hormone balance or your ovarian function or periods and things like that. Because generally speaking, I find it's always the case, really. When you've got a physical condition, there's always an underlying emotional component to it as well. So it's very, very important to actually address that as well so that you can move on and actually heal, not just addressing the physical cause. And basically, it's a technique. It's don't know if any of you have heard of kinesiology, but it's kind of similar to that. So it's using muscle testing to find the underlying emotion or stress, but we can actually pinpoint and locate it because we actually use Chinese meridian points located on both sides of the wrists and the palms. And we can actually find exactly what organ it is and what sort of corresponding emotions it's related to, and then go in and actually clear it off using EFT and actually holding the meridian point to actually clear off that emotion as well. So very, very important work. So if you are keen to actually get started and work with a naturopath, I would absolutely love to help you. So I'd encourage you to book a free 15-minute discovery call to see if we're a good fit and to sort of discuss a little bit more about how it works and what we would actually be doing together. So I will leave a link for you. On Instagram, actually, the link is in the bio. On Facebook and YouTube, I will actually pop the link underneath for you, so you can go ahead and do that. And is there any questions before I finish up today? Sorry, I'm a little bit tongue-tied. It's just been a bit of a long day. I'm sure you can understand that. Any questions before I finish up there? Well, it's been an absolute pleasure talking to you. I've absolutely loved it. As I said, if you have any questions at all and you're a little bit shy, you can send me a DM or a PM and I'm more than happy to answer that for you. If you're watching on my YouTube channel, be sure to like and subscribe. And usually I'm here every Wednesday evening, so 7:30 p.m. Australian Eastern Standard Time, talking about something hormone and or fertility related. Next week I won't be on though because I'll be going camping the next day. So just keep that in mind, but I should be back on board the week after. So I will see you not next week, but the week after. Thank you so much for joining me. Thank you. Bye.